Let's learn about stroke. Stroke, also known as cerebrovascular accident, CVA, is a medical emergency that occurs when blood flow to the brain is interrupted or reduced, leading to brain cell damage or death. Stroke can result in serious long-term disabilities or death if not treated promptly. Causes. The most common cause of stroke is a blood clot that forms in one of the arteries that supply blood to the brain, which is known as an ischemic stroke. Another less common type of stroke is hemorrhagic stroke, which occurs when a blood vessel in the brain ruptures and causes bleeding. Risk factors for stroke include high blood pressure, smoking, diabetes, high cholesterol, atrial fibrillation, age over 55 years old, family history of stroke or heart disease, previous stroke or transient ischemic attack, TIA. Symptoms. Symptoms of stroke depend on the part of the brain affected and can include sudden weakness or numbness of the face, arm, or leg, usually on one side of the body. Sudden confusion or trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, or loss of balance or coordination. Sudden severe headache with no known cause. Diagnosis. Diagnosis of stroke usually involves a combination of medical history, physical examination, and diagnostic tests. Tests used to diagnose stroke include brain imaging tests, such as a computed tomography, CT, scan or magnetic resonance imaging, MRI, to determine the type and location of the stroke. Blood tests to check for underlying conditions that may increase the risk of stroke. Electrocardiogram, ECG, to check for irregular heart rhythms that may cause stroke. Carotid ultrasound to check for blockages in the arteries in the neck that supply blood to the brain. Treatment. Treatment for stroke usually involves emergency medical care to minimize brain damage and prevent further complications. Treatment options include medications to dissolve blood clots and improve blood flow, such as tissue plasminogen activator, TPA, and aspirin. Procedures to remove blood clots, such as mechanical thrombectomy or endovascular therapy. Surgery, such as carotid endarterectomy or angioplasty and stenting, to open up blocked arteries or remove plaque buildup. Rehabilitation, including physical, occupational, and speech therapy, to help patients regain function and independence after stroke. Prevention. Preventing stroke involves managing risk factors such as high blood pressure, smoking, and diabetes, as well as adopting a healthy lifestyle. Common prevention strategies include quitting smoking, maintaining a healthy diet and weight, regular exercise, managing high blood pressure, diabetes, and high cholesterol, taking medications as prescribed by a healthcare provider, managing atrial fibrillation with medications or other treatments. In summary, stroke is a medical emergency that occurs when blood flow to the brain is interrupted or reduced, leading to brain cell damage or death. Stroke can result in serious long-term disabilities or death if not treated promptly. Treatment for stroke usually involves emergency medical care to minimize brain damage and prevent further complications, and prevention involves managing risk factors and adopting a healthy lifestyle. Let's learn about peripheral artery disease. Peripheral artery disease, PAD, is a condition in which the blood vessels that supply oxygen-rich blood to the legs, arms, and other parts of the body become narrow or blocked. This reduces blood flow to the affected area, leading to pain and other symptoms. Causes. PAD is usually caused by atherosclerosis, which is a buildup of plaque, cholesterol, calcium, and other substances in the walls of the arteries. Risk factors for atherosclerosis and PAD include smoking, high blood pressure, high cholesterol, diabetes, obesity, family history of heart disease or PAD, age over 50 years old. Symptoms. The most common symptom of PAD is pain or discomfort in the legs, especially during physical activity. Other symptoms may include numbness or weakness in the legs, coldness or discoloration of the legs or feet, sores or ulcers on the feet or legs that heal slowly, weak pulse in the legs or feet, erectile dysfunction in men. Diagnosis. Diagnosis of PAD usually involves a combination of medical history, physical examination, and diagnostic tests. Tests used to diagnose PAD include Ankle brachial index, (ABI) test, which compares the blood pressure in the ankle to the blood pressure in the arm to check for blockages. Doppler ultrasound to check blood flow in the affected area. Magnetic resonance angiography, MRA, or computed tomography angiography, CTA, to create images of the blood vessels. Angiogram, which involves injecting dye into the blood vessels and taking X-rays to visualize the blockages. Treatment. The goal of treatment for PAD is to improve blood flow to the affected area, reduce symptoms, and prevent complications such as amputation. Treatment options include lifestyle changes, such as quitting smoking, exercising regularly, and eating a healthy diet. Medications to manage symptoms and reduce the risk of complications, such as aspirin, cholesterol-lowering drugs, and medications to improve blood flow. Angioplasty or stenting, which involves inserting a catheter with a balloon or stent to open up the blocked artery. Surgery, such as bypass surgery, which involves rerouting blood around the blocked artery. Prevention. Preventing PAD involves managing risk factors such as smoking, high blood pressure, and high cholesterol, as well as adopting a healthy lifestyle. Common prevention strategies include quitting smoking, maintaining a healthy diet and weight, regular exercise, managing high blood pressure, diabetes, and high cholesterol.